You might not realize this, but your body is full of bacteria. And I mean really full. But there's nothing to worry about, because most of them do a very useful job inside your body. I speak about this with Professor Claassen from the Netherlands. He's an expert on this field. These bacteria, how many are there in our body?
Well, basically it's about 1.5 kilograms of live bacteria in your gut, translated in scientific terms as 10 to the 14th, or 100,000 billion bacteria, which is 10 times more than the number of body cells you have. So actually you are not alone, you're with 10 others.
How did they get there?
Well, basically, once you are born, either through the natural birth channel or through a cesarean section, you acquire the bacteria in the first weeks of life from your environment and from your mother.
From the milk? You mean?
From the milk. Recent studies have even shown that actually in the milk glands bacteria are produced, so that you don't pick up the bacteria just from outside the nipple, but also from inside the milk glands. And those are very spectacular data, because it shows that the body is really preparing you and giving you these bacteria to help you survive those initial first months.
And once they're there, inside our bowel, what are they doing there?
Well, your gut bacteria, if you know that it's 1.5 kilogram, you have to know that they have to do something good, because normally if you have 1.5 kilogram of pathogens or disease-creating bacteria, you would die on the spot. So what we know is that they help us to digest the food, they produce vitamins, they produce compounds to suppress other pathogens, so yeasts or fungi or viruses or parasites in the gut are suppressed by those bacteria, and they have a very important role there.
So they're not only playing a role for a healthy intestines?
No. What we now know, and that is knowledge that has been evolved over the past 15 years, is that these bacteria actually help the total body, the total system, from within the gut. So they don't venture outside the gut, but from within the gut, by their crosstalk with the gut epithelium, so with the gut barrier, they can influence all functions in the body.
And now, the balance in the gut flora between the so-called good and the so-called bad bacteria, how is this disturbed?
Well, there are many ways in which the balance can be disturbed. Food intake, antibiotics, extreme sports, trauma by accidents, age, either very young age or old age. The most significant disturbance is by the diet, changes in diet. Excellent examples of that in the westernization of the diet, for example in Japan or in Lithuania after the fall of the Berlin Wall. You saw that the people were using more sugars, more fat, more meat and less vegetables. So a radical diet change to a more westernized diet, and then you see that the profile of the bacteria in the feces changes, and that also gives rise to an increase in what we call allergic diseases like dermatitis and skin diseases, eczema and asthma.
And what can we do to prevent this disturbance?
Well, basically, of course, a diet change is difficult to prevent, because that's a socio-economic cultural change, which, if your children want to eat more pizza, it's very difficult to avoid that. Antibiotics, which also play a role in this story. If you have a certain disease and you have to have antibiotics, then your gut flora will change, and there's nothing you can do to prevent it. What you can do, however, is of course take care of your diet. So make sure that you use less simple sugars and more vegetables and less animal fat and more fish with omega fatty acids. So you can do a lot with your diet, but you can never always prevent these changes.
And when these changes occur, you can take probiotics. They help to restore the balance of your gut flora.
Probiotics actually work on 5 different levels. Primary level is the competition for space and the competition for food in the gut. I always compare that to the full bus idea. That means if you have a bus stopping at the bus stop and there are hooligans standing there who are on their way to a high-risk game, and the bus is full of innocent people, then maybe 1 or 2 hooligans will get on the bus and they probably punch somebody a black eye, but that's about it. Whereas if the bus is empty, think of a gut after an antibiotic cure, then a lot of people will hop on the bus, all the hooligans will have a big party and they will probably completely destroy the bus. And that's the same in the gut, so you have a competition for space, a competition for food, but also, and more importantly, the lactic acid bacteria present in your gut, they produce a lot of toxins to actually attack the hooligans. Now, lactic acid is one of these toxins, but they also produce hydrogen peroxide, alcohol, formic acid, butyric acid, and toxins that can actually prevent the growth of other bacteria, yeasts, fungi, viruses in the gut. And the 5th level is actually the immune system, which is in a constant dialogue between the immune system of the gut and of the body and the content of the gut. And this is regulated in what we call danger and no danger signals. That means that the immune system is continuously monitoring the content of the gut, whether there is a dangerous situation, yes or no. And this monitoring can be influenced or fooled, if you want, by using probiotics.
The other day there was an important international congress in Maastricht for scientists. Yeah. You were there also. On probiotics. How was the atmosphere? Were people optimistic about this?
Yes, there was a great sense of enthusiasm, and there were also very interesting findings in man, in humans. Most notably, I think, the relation between the gut and the brain, the gut-brain axis, which seems to be a two-way street where the brain actually takes signals from the gut content, from the bacteria, which signal through the epithelial cells in the gut wall, and the other way around. And this has great consequences for migraine, for autism, for memory, happy memories and sad memories, especially in patients with irritable bowel syndrome. And the other hand was what we call the repopulation studies, where the role of the healthy microbiota in obesity is now under study.